Welcome to Magnolia Medical Minutes, your local source for expert medical insight direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of Super Talk Mississippi Media, and today's special guest is Digestive Health Nurse Practitioner Ashley Long. Thanks for joining us today, Ashley.
Thanks, Andy.
So today's topic is fatty liver disease. Tell me, how prevalent is fatty liver disease?
Fatty liver disease is very prevalent in our area because a lot of patients who have fatty liver also have other metabolic disorders such as hyperlipidemia, diabetes, sleep apnea, cardiovascular problems. All these little diseases kind of run hand in hand, and fatty liver runs along right with it most of the time.
So who is at most risk to develop it?
Any patients with those conditions we just discussed, anyone who is overweight, anyone who drinks a lot of alcohol, any of them can have this.
What is the process of screening for it?
It's usually found incidentally when primary care, urgent care, whoever's doing blood work that shows maybe a little elevation in the liver enzymes, or if they have imaging for another problem that just happens to show fatty liver on the scan. That's usually how we find it. And then a lot of primary care providers will refer to our clinic at Magnolia Digestive Health, and we have some non-invasive tests that we can look a little further into it and see if there's any kind of scarring that's developed or any kind of liver lesions, that sort of thing.
So as a patient, if it's been found and diagnosed, what is the process of treatment? What does that look like?
Treatment is going to depend on how severe the scarring is, if you have any at all. So the biggest thing we encourage is weight loss. Mediterranean diet is a great diet to follow. It's heart healthy, it's good for losing weight. The other things we do is encourage exercise most days of the week. There's some new medications that have just been approved that we can use depending on if there's any kind of fibrosis in the liver. So there's a few things that we can do now that's a little better than in the past.
Where should I go to get checked and screened?
You can call our office for an appointment, Magnolia Digestive Health. You don't have to have a referral if you've ever been told you had fatty liver in the past or recently, or you just have those other metabolic problems and you want to get checked out. We can see you, order appropriate tests, and then follow up with you regularly to keep a watch on this.
How about follow-up? How often does that need to happen?
If there's no fibrosis or advanced scarring, 6 to 12 months is pretty appropriate. If there is, then every 3 to 4 months would be better.
Awesome. Well, thank you for your time.
Thanks, Andy.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight direct from the providers at MRHC in Corinth.